And we are joined now by Dr. Bob Sonawane. He's a professor at Georgetown University in Washington, studying health risk assessment of chemicals and policy. Such an interesting and vast topic. Thank you so much for joining us, Doctor. We're going to start with some examples of disparities in environmental chemical exposure and health risks to minority and susceptible populations. Can you try to tell us a little bit about that?
When we say that we are talking about this low-income tribal communities and African-American population and poor white for that matter, all of these people are disproportionately exposed to the air pollution, water pollution, and hazardous waste dump sites. In Los Angeles, here in California, for example, has a very high pollution, air pollution. There is a fine particulate matter called PM 2.5, particulate matter 2.5, that's the diameter. And they dodge in the lungs and causes all kind of respiratory issues. That's number one. The number two, that respiratory problem also causes cardiovascular disease. A lot of cardiovascular disease in this particular population compared to the other ethnic groups or racial groups. And so these minorities, if you want to call them, or the racial groups, have disproportionate exposure of these, through the air pollution.
It leads me to actually my next question.
Yeah.
This might be a good point to go there. What are some of the research needs in order to address these disparities?
There's a task force, interagency task force. 17 federal agencies in the United States are coordinating and focusing during this administration, Biden administration, focusing on the environmental justice research issues.
What can members do if they want to get more involved in this research
Well,
or the policy side?
Yeah, at the community level, I'm talking local community level, people can develop and understand what the federal agency is doing. They have a lot of opportunities for the members of society to apply for the grants. I know that NIHS, National Institute of Environmental Health Science, is funding a lot of research in this area. And so if I'm an academician, I will be looking for those kind of research grants. And the second thing also, the US EPA is also funding a lot of research in this area. So from a perspective of an academician, a researcher, I would look for those opportunities to do more in this area.
Of course.
One of the things is we need to systematically map the entire population in terms of creating a demographic system where we can look at how these populations are disproportionately exposed.
I want to say thank you so much for being here
Okay.
with us in the studio. Dr. Bob Sonawane, professor at Georgetown University.